We'll bring him in.
Then there was 3.
All right. Good morning, everyone. Thank you for bearing with us. We were a little late this morning, but that's okay. We had some technical difficulties, so bear with us. Welcome to the CareSouth Carolina Community Live Podcast. We have a great show in line for you today. We have with us, first of all, my name is Marek Calhoun. I am the Director of Social and Community Services for CareSouth Carolina with my partner in crime.
This is Daniel Myers. I'm the MATHD Program Director for CareSouth. Glad to see everybody.
All right, absolutely. Like I said, we have a good, fun show, a lot of information for you today. We welcome to the podcast, first off, Miss Jeri Andrews, and I'm going to give her a second to introduce herself in quite a minute, but we're waiting on Dr. Joshua Hubbard. He is our Director of General Medicine. So, Jeri, if you could, and we'll join him in as he gets back. All right, Jeri, if you could start us off by introducing yourself. Tell us how long you've been with CareSouth and your title, who you are. Give us a little tidbit about who you are.
Sure. Yeah. Hey, everybody. Happy Friday. Yay, TGIF. I'm Jeri Andrews. I am a nurse practitioner. I have been with CareSouth Carolina for 10 years. I began my career at CareSouth actually as a student. When I was in my nurse practitioner program at USC, I did some clinical rotations in our Bishopville and Hartsville office. And then I ended up landing in Hartsville, and I worked in the clinic in Hartsville for 5 years. And then we began our mobile healthcare program in 2015. And so I began working on our first mobile unit then. A couple years later, I was promoted to Director of Mobile Health Services. And then about a year or so after that, my title changed again to Director of Mobile Health and Offsite Services. So I oversee 3 of our medical mobile units, as well as an on-site clinic at Rubicon in Hartsville and a public employee services office in Bennettsville.
Wow, that's a lot.
Wow, that's a lot, Jeri. Jeri, I can really say that you're on the move.
Yeah. I'm always doing something, always.
Yeah.
There you go.
And most recently, I didn't add this, but most recently I have helped implement our telehealth program. So I oversee the clinical aspect of the telehealth program at CareSouth.
Well, I can say your job is really taking CareSouth places.
Yeah. Lots and lots of places. It's always
Absolutely. And guess what? We have a guest.
Hey.
He's back.
I don't know for how long, so.
All right. So we were just going through introductions, Doc. I kind of gave them a warm introduction of you. If you could take it from there, kind of tell the folks who you are, how long you've been with CareSouth, and just a little bit more about yourself, where you from, all that type of good stuff.
Okay. I'm Joshua Hubbard. I'm the dental director. I've been with CareSouth about a year and a half. Before this, I was in private practice. So I'm kind of new to public health, but I'm learning quick. So it's been a really rewarding year and a half so far.
Wonderful.
Absolutely.
Wonderful.
Okay. So just to start us out, Jeri, since you hit the scene first with the medical mobile unit, kind of give us some insight about the medical mobile unit and its function, its primary function, and we'll go from there.
Okay, so like I said, we have 3 medical mobile units. So the majority of our program is school-based health. We have relationships with Dillon County School District, Marlborough County School District, Lee County, Darlington County, and Chesterfield County. So we provide services on site at the schools in those counties to students who sign up for our program. On the mobile units, we focus on well child visits. So well child visit is that yearly visit that's recommended for all children age 0 to 18, and then it's even recommended for adults as well. Of course, for the younger children, well visits are recommended more frequently than yearly. But we're talking about really age 4 and up when we get to the schools. So it is recommended yearly. We have a nurse practitioner, a nurse, and a medical assistant on each unit. So we do provide the well visit. Just to give you a little bit of rundown of what a well visit entails. We do full set of vital signs. We do a nutrition assessment, physical activity assessment, medical history, social history, a complete physical exam by a nurse practitioner, vision screening, hearing screening, and of course, if there are any abnormalities or any issues going on with the child, that they will take care of it or refer out if necessary. So that is the majority of our program. We do have one of our units who partners with 2 area DeOtis agencies, and that would be Rubicon in Hartsville and Alpha Center in Chesterfield. And we have a nurse practitioner who is certified to treat patients who suffer from opioid use disorder in our Suboxone program. It's not just Suboxone. We don't really call it our Suboxone program, but that nurse practitioner is what she specializes in. And so she sees patients on site at Rubicon and Alpha in conjunction with the counseling that they receive at those locations.
Wonderful.
Great information. All right. So, Doc, tell us a little bit about your program, and because you got a lot of aspects to your program, because you cover a lot of landscape, everywhere from mobile to school-based to
Yep. So we actually have a fixed site in Bishopville, which we take adult and children, and we do full service dentistry for the children, and we do limited scope for the adults, which include exams, filling crowns, extractions. We have school-based teams that would go. We have 4 dentists, and they go to the schools and set up inside the school to treat the kids. And we also have 1 dental mobile unit that we can put wherever it's needed.
Oh wow, that's great. And going back to Jeri, talk about the school-based program. Did you talk about that?
I did. I just gave a brief overview, but we started our school-based program in 2015. And we started at first in Chesterfield County School District. And then we have since expanded to all the other school districts I listed earlier. We service a total of 57 schools now.
Wow.
So, yeah, we provide services on site at 57 schools, and that is with 3 nurse practitioner teams in the 3 units. So in addition to the well visit that we provide, we also partner with lots of our athletic directors in our school districts, and we offer sports physicals during this. Usually during the spring is a big sports physical season. So we're able to do the sports physicals on site at school, sometimes even during the school day. So the advantage of the sports physicals and the well visits is that your child is able to get this visit. They don't have to miss school. They're not counted absent. They're not missing any important instructional time. We do work with each of our schools, and we try our best not to let a student miss any of the core classes like English, math, science, etc. We usually try to pull during a recess break or during an elective class so that they're not missing crucial instructional time. So our schools really prefer that model, and especially with the sports physicals too. And what a lot of parents don't understand, I think, is that a complete sports physical is pretty much a well child visit. So if you're doing a thorough sports physical on a child, you are hitting all the high points. You're doing a head to toe assessment, and you're going to find any abnormalities that you would find on a generic well visit. So it's a big advantage for our students for us to be able to provide that service. So, of course, if there are any athletic directors or schools that we have not partnered with in the past, we'll be glad to do so. And we do understand that right now we have a lot of uncertain times, and many schools aren't doing any sports. Sports camps and practices and games have not resumed because of COVID. And that's changed our process a little bit. While I'm talking about that, I'll go ahead and let you guys know how we have updated our safety protocols in response to COVID. We did provide services on site to several schools over the summer. Everything went really well. We updated our protocols to screen each child with a series of questions related to COVID exposure and testing, and also had their temperature taken before they ever entered the mobile unit. At most schools, we had a table set up either outside or right at the entrance of the school. They were screened there before they were allowed to come onto the mobile unit, so that if they screened positive with any of those questions or if they had a fever, we did not allow them on the mobile unit. We were keeping our mobile unit a well unit. And then once they were allowed to come on the mobile unit, we only allowed one child at a time, even though our mobile units are set up with a waiting area in the middle and 2 exam rooms, one on either end. We only allowed one child at a time so that we could properly clean and sanitize after each child. And that was just to limit, any potential exposures, because we really value the safety and well-being of our children. Everyone, including staff, children, parents, everyone was required to wear a mask from beginning to end of the visit. If they didn't have one, we provided one. And this will be the norm for schools. They are going to require their students to be masked. We'll be following that procedure as well.
So, Jeri, let me ask you a question.
Yes.
If I was a parent that was interested in getting my kid involved with the school-based program, what would I have to do to get to enroll my child, or even get information on the requirements for that?
So at the beginning of every school year, we send home our parent letter and consent form with every child. And I can kind of show you, I don't know how well you'll see it, but it looks like this. This is actually a Spanish version, but you'll see our mobile unit up at the top, and that's a picture of what it looks like. The front is a parent letter, and the second page is a front and back blue enrollment form. It has information such as demographic information, name, date of birth, address, phone number. It has some financial information. We'll ask for your insurance. And then on the back are health history questions, past medical history of the child and immediate family members. And at the bottom is a blurb about our consent, what you're consenting to as a parent, and then we ask you to sign. So if you're interested, you fill the form out and you return it to your school, who in turn returns it to us. We process the forms. If we have any questions about anything, if anything is incomplete on the form, we reach out and we call the parents. And then throughout the school year, we schedule with each school a time that is best for us to come on site. So, the school year runs from August to pretty much June. So we could come at any time during the school year. We normally keep a schedule. So if we go to school A normally in August, September, October, we keep that same schedule about every year. It won't be the same exact day or the same exact month, but we go about the same time. So we do bill insurances. This is not a free visit, but we don't turn any children away. So we accept all Medicaid, Medicare, private insurances. We also have a sliding scale fee program for children who are uninsured. And that information is on the front of the form that we ask parents to fill out. And if we see a child, we run across a form and we see the child doesn't have insurance, we're actually reaching out to that parent. We have a community health worker on staff who can assist with applying for benefits such as Medicaid, food stamps, things like that. So we have lots of resources for our students, and we try to get them on a coverage plan if they qualify at all. And for those that don't qualify, like I said, we have the sliding scale fee program that is based on household income. And we'll discuss all that with the parent, what their bill would be before we go see the child.
Okay, so for everybody that's listening, if you're not sure whether or not your school participate in this, contact your local district office, or contact your school district and find out if your school participated in this program, because it's very important, very good program for your children. A lot of times you don't have to get off work to have those well child visits done when they can be done right there at the school. So this is an added convenience and added plus for that school district and for those children and for the parents. So it's a win-win for everybody. So get in touch with your local school district and find out if your school participates. If they don't participate, find out how you can get your school part of this program and have them enrolled in our school program. I don't think Jeri will mind taking on 100 more. I mean, we're doing pretty good with what we got. So
that's right. Bring it on. Bring it on.
Yeah,
Absolutely.
yeah. Thank you, Jeri. Thank you. Your team does an excellent job. Thank y'all very much.
Thank you. We appreciate everyone's support, and we really love what we do. We love being there for the community, for the kids, for the school district staff. We think we offer a wonderful service, and we enjoy doing it. So thank you for letting me come on here and give my spiel about what we do.
Hey, we believe in promoting our heroes. Thank you.
Thank you.
Woo!
Yeah.
I get my $5 after the session. You owe me for that one.
Okay. Yeah. I'll Venmo you.
Thank you. Marek?
Marek's frozen.
Aw. I can show you guys while we're waiting on Marek to unfreeze himself. Our dental program also kind of does the same concept with parental consent. So to show you what their form looks like, just so you can see it, it's a parent letter on the front, and their form is a front and back consent form that's purple. You guys can see that. So yeah, we share many schools. I think about 30 or so.
Yeah, we have a total of 47 schools at this point.
Oh, okay. Yeah. Wow. So all 47 of the dental schools are also road schools. And I don't think I even told you this, but our program is called ROADS. So you'll see that on all our forms, ROADS. And it's an acronym for reaching out and delivering services, because that's what we do.
That's right. And also your MAT unit that goes to Rubicon and Alpha. It's called what?
Better.
We hear you now, Marek.
Yeah, we heard something.
Yeah.
Tell us a little bit more about your roads, your unit that goes to Alpha and Rubicon, the MAT unit.
So we have names for all of our units. We've named each one. Our very first unit that we got was called Mobile Roads. Our next unit was called Care Roads. And so first of all, Mobile Roads, the name came just because we're mobile. And I told you what ROADS stands for. Care Roads came from CARES funds that we received to actually purchase that unit. So not only is that our school-based unit, but that is also our unit that we can deploy in the event of any natural disaster emergency. So for instance, we have a hurricane that knocks out one of our fixed site offices, or either it's damaged or there's extended power outages. We can deploy that mobile unit on site so that patients can still receive care. We can staff it with a nurse practitioner. Patients can come out and receive care on that unit.
Wow, wonderful.
Yeah, our third unit is called Freedom Roads. And so, and that's the unit that provides the MAT services on site at Rubicon and Alpha. And we came up with the name Freedom because we thought it was fitting for the MAT patients to give them freedom from their addiction.
Wow.
So our nurse practitioner that is staffed on that unit actually came up with that name, and we really love that. So that unit goes out to Rubicon Center on Wednesdays and Alpha Center on Thursdays every week. And so if patients are interested in being seen on that unit, they would contact those agencies directly, and the counselors at those agencies would refer them to us.
Okay.
And so we work together. So, and we did this so that patients could come one place for all of their services. So instead of having to go to a medical office to see their provider to discuss their prescription, and then a second place for their counseling, they can come for one visit. They can see their counselor. They can do their drug screen if that's needed, and then they can see their medical provider, like a one-stop shop. We have a lot of patients who have transportation issues who can't get to 2 appointments in 1 week. And so we try to make it a little easier for them. They can come one place and get their services.
Right. Wonderful.
That sounds good.
So if you're interested in that, you would contact Rubicon if you live in the Hartsville area, and you would contact Alpha Center if you live in the Chesterfield area.
Wonderful. All right.
That's some good information.
Okay.
Hey, Marek.
Yeah.
Love technical difficulties.
Yeah. I think
we did serious technical difficulties. I think it's a lot to do with the weather today.
Yeah.
And if you can hear me, Doc, we definitely would love to hear a little bit more about the Bishopville dental office that we have there, and in Bishopville, and its specialty, and what are you doing right now?
Absolutely. We're a predominantly pediatric dental office. We see about a mixture of 80% children and 20% adults. And we do high quality, full service dentistry for the kids. And, we're trying to help as many kids as we can. The leading cause of kids missing school are toothaches. And so if we can do our part to help out with that, we want to. And so, we have that office, and then we also staff a lot of our other CareSouth locations with dentists. So there, in most of our locations, there is a room or rooms where we can provide dental services. So we go around and do that too.
Well, I mean, I'm glad you said that because you have a unique system, that portable dental system. Take us through how that works in relation with the school, or even like you said, a CareSouth location, or a location within the community, right?
Yep. So we have units. They're called Aseptico units, and they were designed for the military to be portable units to do frontline dentistry for soldiers. And we use those in our offices and also in the schools. And so we can wheel it in, and it's self-contained, and we can do full service dentistry with those. And so we have all the modern stuff that you'd find in any dental office. And I think people don't realize that we are held to a pretty high standard. We are accredited by the Joint Commission, which is a much higher bar to meet than what you'd find in a normal private practice office. And so we're doing really high quality stuff. So, anybody who needs us can be assured that they're going to get the best care that they can.
Yeah, I definitely can see. I was very impressed when we first got that portable dental. All you need is a space.
That's it. That's all we need.
Right? That's all you need, right?
And we practiced in what would amount to a closet to, a gymnasium. So if you got a spot for us, we can come do it.
Wow. That's
and so this is for both of you guys, since you have mobile services. Do you guys do any events or anything for the community, or if somebody wanted you guys to do anything for the community, what would they have to do?
Just contact one of us. We can roll our mobile units out to just about anywhere.
Is there an event size? Is there a certain amount of people that you need to have there to have this event done? Is there a minimum amount, or what do you need? What's the requirements?
Not necessarily, Jeri. Do you guys have any minimum?
We don't really set a minimum amount. It just kind of depends on the nature of the event, what service the entity is asking for, as to whether it's appropriate for us or not. But, if you have a question, please call us. We can let you know if it's something that we can do, or maybe one of our other programs within CareSouth would be a better fit. We have lots of outreach programs, and sometimes entities, want a community event. They don't necessarily need a mobile unit. Maybe they just need some staff. They may not have space for it. It just depends, but we're always available to answer those questions. And 9 times out of 10, we have a resource or a program that fits your need.
Absolutely.
Yeah, that's true. I can tell you firsthand, the sisters Jeri and Doc with their mobile units have been with our agricultural farm worker program. They have really their divisions have really been a great assistance to us, because we're able to bring those services to the farm workers without them having to really come to us. We could take the services to them, you know what I mean, and go out and service them at the farm, which kind of, again, just like Jeri alluded to in school with the kids, it keeps them from having to pull them out of school and interrupting their studies. Same thing with those farm workers. In essence, them being away from their job, they're able to get the services they need and then go right back to work within a short amount of time.
Yep, that's all about what our acronym is about. We reach out and deliver services. So we come to you at we meet you where you need to be met.
Absolutely.
It's coming into an office is just not for everyone. Everyone doesn't have the flexibility in their schedules to miss a half a day of work to come to an office for an appointment. And we understand that, especially with our children. Instructional time at school is so very important. We want to be able to provide those much needed visits, but not have to make the child miss school and the parent miss work. So that's 2 people for 1 visit that have to miss something very important in a day. If we can alleviate that, then we're doing something good there. And just to add on to that, that's where our telehealth comes in as well. And so we're offering that right now to all of our patients. If you call CareSouth to schedule an appointment, you have the option to see your provider via telehealth. Now, there are a few things you may be having a visit for. They're not telehealth appropriate. There's some things that you just need to come in an office and someone needs to lay hands on you, and you need to be seen face to face. But your provider can discuss that with you. But there are some medical issues that you have that can be handled in a video face-to-face setting, just like we're talking now. You get to see someone and have a conversation with them and discuss anything you want to discuss, and you can do it from the comfort of your home. And you can see the provider, you can get the same medical advice, you can get prescriptions called in. So please take advantage of that. Please ask about it. When you call to schedule, you should be offered a telehealth appointment if it's appropriate. If not, ask. Most of our providers in all of our offices are offering that as an option. We want all of our patients to feel safe. We don't want you to feel unsafe coming into any of our offices and sitting in a waiting room. If you feel like that's not appropriate for you to do right now, then please take advantage of the telehealth.
We also have teledentistry available.
Yep.
Wow. So I like the idea of CareSouth being able to reach people mobily, but I also like the idea of CareSouth doing holistic care even on the road. The same care that we offer in our fixed sites, you guys offer that same quality of care on a mobile basis, and it gives our patients a sense of home, right? Everything that they need is done under one roof, with the exception of prescriptions, because they do have to go to our fixed sites and to our pharmacies and pick up those prescriptions. But other than that, you guys are handling everything else there. You're handling the body itself, and then the mouth, which is the gateway to health. You guys are handling that as well. So this is a wonderful program that CareSouth has, and I'm a big advocate for it. And I really wish that all schools would get involved because it's beneficial to our children.
Yes. And I'll say also, we also are offering behavioral health counseling via telehealth. So, if you would like to see a counselor, you can do that over the phone or over telehealth. So call and ask for that appointment as well. We do also have behavioral health counselors in several of our area schools that are available on site, and they see children during the school day. So I forgot to mention that. They're not really considered part of our mobile program because they are on site at the schools. But if you're interested in that for your children, just ask your school if they participate. They will be glad to take the referral.
And we actually have them on next week. Our school-based counselors will be on next week, so they get more information about that on next week as well. So,
cool. Yeah, y'all hear all about that next week. Then it's a great service.
Oh yeah, it's a great service, really great service, really beneficial.
All right. That was some great information you guys provided. Again, we apologize for the choppiness of the video, the podcast today. Others not cooperating with us. Technology can be that way. Can be very unforgiving, right? So what we're going to do is we're definitely going to go back and we're going to review, do what we always do, review the tape, as they say. And, the beauty of this is impeding the information. You always do it again.
That's right.
Take two.
We can always do it again. So, again, we want to thank you guys for coming on today. But despite the technical issues, I got one question I always like to ask folks at the end. Not necessarily a medical question or even a work question, but what do you like to do when you're not at CareSouth? You kind of need to relax. These days, in the age of COVID, we all need that time to relax after work or on the weekend. It's Friday. We made it. So what we doing this weekend?
I'm actually playing a gig this weekend with my band.
Oh,
cool.
Yeah.
What do you play? What do you play?
That's right.
I play bass and guitar.
What?
It's a little fun thing I do on the side.
So what genre of music do you play?
We kind of cover a lot of ground from country to rock. So
Wow.
we haven't gotten into hip hop yet, but
Yeah, it's just right around the corner.
Yeah, I know, right? I'm sensing a theme here, and I say that because the last general director we had, he was in the rock too. He was in a band too, if I'm not mistaken. Right?
Was that Dr. Boyens?
Yeah.
Yeah.
Dennis like the rock, huh? Dennis like the rock.
Was that a few questions?
But he had the mohawk though.
He did. Yeah. What about you, Jeri?
Well, I am not musically inclined, and you guys do not want to hear me attempt to play a musical instrument or sing. But I do love to listen to live music, so that is a pastime of mine. And right now, it's kind of iffy. We're not can't really congregate, but you can go to outside events and things like that. I do love being out on the lake or at the beach. We have a boat, so we like to take it out. I love the outdoors. I love it when it's hot outside. When it's cold outside, I sit in my house and wish for summer. And I love to travel. That is probably my most favorite pastime, which I have not been able to do for the last 5 to 6 months. So I've had to get creative and pretend my backyard is another country.
Wow. Well, me and Marek can get we can get what both of you guys do, because I love music too. Both of us love music, and we love the water because we love the fish. And when you can put those two things together, that's a wonderful vacation and staycation. You understand what I'm saying? So,
yeah.
And Jeri, I know I impressed you a few minutes ago when I used that word genre.
Oh.
Yeah, I had to look it up before. I had to look it up first before I had to make sure I was saying the right thing. You know how I do.
You got that big old brain up there now, Daniel. Come on.
Yeah, no, my head just boggling. A whole lot of brain, just a whole lot of no hair. That's it.
Oh man! But listen, hey, it was great, guys, and we appreciate it. Anytime we're able to impart some information on folks out there, really good information that's going to help them, help their families. We always welcome to do it, and y'all accomplished that today. Thank you.
Well, we appreciate that too.
Yeah, thank you for having us. This is a lot of fun.
Absolutely. And if you need more information about our dental program as well as our mobile services program, you can reach us out at www.caresouth-carolina.com. Again, that's www.caresouth-carolina.com, or you can reach out to us via telephone at 1-866 498-0399, 866-498-0399. Again, thank you, everyone, and we're out.
Thanks, guys.
Bye.